Welcome to Talking HealthTech. I'm your host, Sophie, and today I'm joined with Will Hadden from Oneview. Will, welcome.
Hello. Thank you so much for having me on. Talking HealthTech's fantastic, great community, amazing podcast. So it's great to, be on one for a change.
Yeah, it's nice to have you here. I know we've been talking about it for a little while. Can you tell our audience who you are and what you do?
Yeah, sure. So my name is William Hadden. As you've heard, I'm Managing Director of Oneview's ANZ region. I've been with Oneview for about 8 years, and Oneview provides a care experience platform within the hospital setting, so improving the lives of patients and also assisting with some care team workflows as well. All about the technology.
Yeah, amazing. And I know we recently were sort of talking about the perspective and what we were going to cover today. And then I think, was it last week, you became a patient yourself?
Yeah, a slightly unscheduled bit of market research there. Unfortunately, I was doing some DIY and managed to crush and injure one of my fingers. So there was a emergency trip to emergency at Royal Melbourne, and unfortunately then admitted and then had to have reconstructive surgery on my finger. So good opportunity for me to give a massive shout out and a thank you to everyone at Royal Melbourne, from emergency to x-ray to ward staff and theatre staff. They looked after me and got my finger put back together. So amazing care and an interesting insight into being the patient for a change. Obviously, I'm in hospitals a fair bit, but a bit more refreshing just to see things from the patient's eyes.
Yeah, it's an incredible length to go for market research for our episode today.
It is.
Body on the line.
Hopefully not going to be doing too much more of that. Too much pain.
Too much
and
pain.
Drama.
Well, we wish you a speedy recovery with your finger. Can you tell us a little bit about what that experience was like? And I guess it talks to a very much around where hospitals are and where there's an opportunity to improve that patient experience?
Yeah, absolutely. It's obviously a conversation I have with clients and prospective clients that patients may be out of their normal, comfort zone. They're usually, at home in their environment, controlling the world around them, and all of a sudden they're in a hospital setting where they're not in control and they don't have all the information about what they're doing next, what's happening to them, and they can be very, very vulnerable. So that was a bit of a realization to me as it was happening, just how much of an impact that can be. You're in pain, you're in shock, you're not really thinking about a lot other than that. So that was pretty interesting.
Yeah. So the care experience platform that you guys have, and that I just keep coming back to, the hospital I work in has just gone through a bit of a redevelopment, and we don't even have TVs for our patients anymore. So even having that little bit of something to do while you're waiting is now gone. So I would love to hear a bit more around what a care experience platform can solve and do for the patients.
Yeah, absolutely. It's interesting. Obviously, entertainment is a big part of having, say, a television in a room, but something like a care experience platform can do a lot more. Other than, I just guess, calling it entertainment, it's really about distraction and calming. So if you're in pain and you have nothing to do but to look at your injury and think about your pain, it's not a great space to be in. So having something to distract you is definitely helpful, whether that's entertainment or information or just even communication. I guess that's another point, is a lot of people go into hospital for different reasons. And sometimes it's completely unscheduled, like an emergency, and you're suddenly just whisked away from, your environment, your family. And in other times, it's obviously more scheduled or planned, whether it's, say, maternity or an elective surgery. So even things like communication apps are important, or the ability even to charge your phone. You might not have really had time to go and grab your phone charger from wherever it is. A big one. And, you get to ED and you've got, 23% left and, you need to conserve it. So, look, I guess in terms of what does a care experience platform do, that is the element that a lot of people think about first, but really there's a lot more to it than that, because you're in hospital for a procedure. There's usually a lot of information that might go with that. You're going for an operation. What happens next? You may get some material with you there. There may be some leaflets or brochures, but it's the unknown to a lot of patients. So being able to inform them whether there's sort of targeted education we can assign to them and prompt them to have a look at, whether it's a video or, written article. And some of the other elements are things like meal ordering. It's a pretty important part of any hospital stay. And in a lot of cases, it's still the case that somebody's coming around every patient, every mealtime, every day to gather an order on a paper or a tablet. And if you're not there when it's taken, you might miss an opportunity to order what you want. And that can result in food wastage. So giving the patient a system that lets them have more comfort and control over their stay and their environment is really a key value.
Yeah, and I certainly imagine it has a big part also in like discharge planning, in giving patients that sort of a little more certainty and reduce that anxiety. And well, what happens when I go home? What does that look like? How do where am I? What is the pharmacist coming to see me to deliver me my medication?
Absolutely. So that's a good, I guess, segue into some of the other parts of the care experience platform we offer, and that is the care team view of things. So discharge planning, certainly if it's a planned episode, they can be planning the discharge from day one. Where are you going at the end of your stay? How long are you staying? Do you have your medication? So we've got some workflow tools around that can help prompt the staff to get that information if it's not readily available, or to prompt, say, pharmacy staff to come and chat to the patient about their medication, just so that when they're ready to go home, they really have everything that they need. Because it's not just an on-time discharge, it's a safe and on-time discharge, and also reducing the likelihood that they might need to come back in if they don't look after themselves. So. Yeah.
What makes Oneview, or what makes it a platform as opposed to, I guess,
Yeah, that is a good question. So I think the thing that really makes it a platform is the ability for a hospital or an organization to make it their own. So there are standard configurations and, suggestions we can make when we set it up, but the power to adapt and configure it, and it's scalable. So, you can start small and go big. The implementation methodology we sort of talk about is crawl, walk, run. So you might start with some sort of basic features and settings, but really with all the information that gets gathered about how patients use it and the benefits it's giving your org through looking at the data reports that are available, it really lets you continuously improve and just keep building on the system. I guess, being a platform, there's a lot of things that you can add on. So one of the things that we do very well is integrations and interoperability. So different hospital systems have a lot of different products. Some of the publics have really fantastic EMRs. Some of them are transitioning. Some of the other orgs have just fairly standard PAS systems, but then supported by digital medical records. So there's a huge array out there of different products and services and sources of truth of information that we need to be able to plug into. And that's, I think, one of the other reasons, I guess you'd call it a platform. It's adaptable.
So I guess when it comes to sort of rolling out a platform within a hospital system, I guess you said crawl, walk, run, but what are some of the biggest challenges and barriers to implementation that you guys have found?
I think change management is always key. and you need to be solving the problem. You can't be looking at it and going, here's this great system, it can do X, Y, and Z. It's similar, I guess, in the software development world. You've got to look at the actual problem, the user stories of what pain point you're trying to solve, and think about the fact that, digital technology is really just the tool. It's the way of doing it. The idea is to make something that's seamless and easy to use for the patients and low overhead for the staff managing it as well. So it needs to be something that's robust and stable and, really, really can be ingrained in the way that we work. People are still a big part of the care. So, there's a few things I think on the implementation side.
What stories have come back that you guys have that make you excited about where this can go and what it can do?
For me, a big part is the creativity we can give. So when the system becomes, their own, they can think of using it in ways that we would never really have dreamed of. So with, the ability to change what content or education or goals could be assigned to a patient. I heard of one story where there was an individual that really was a bit depressed and would, struggle to really get up and out of bed in one facility. And the one thing that they really engaged with was listening to ABBA music. And when the nursing staff found out about that, they basically used the system to create a tile that would be, a wake up routine for that long-term patient and put something on their screen. So that was a really novel use no one would ever have thought about, which, still makes me sort of laugh today.
Oh, that's great. We could all use a bit of ABBA in our lives. Yeah,
definitely. There's a few different situations like that. Another one that's, I guess, a little bit more on the serious side is with the system that supports sign-in from nursing and doctors at the bedside. We can show results in real time. So one of our developers had chatted with a doctor at an event and had the feedback that really in a code blue situation, that ability to tap or scan onto the device and get results at the bedside in real time made a real, a difference. The information was there and they could act on that information and, it changed the course for the better. So that was a much more serious example, but really both great.
Yeah, and both impacting patient clinical decision-making in really positive ways.
Yeah, absolutely.
So where to from here for Oneview? What are you excited about in the future?
Quite a lot. I think AI is definitely a buzzword that everybody is talking about. We have a few things being developed on that front. I think the way that you interact with the system is one of them. And the other thing I think is just the interpretation of the data that comes out of the system is another. The other thing that we've done in the last year is create a mobile offering. So one of the barriers, and we were talking about this a little bit earlier, one of the barriers in implementation can be if you need to uplift technology in a room, it can get fairly expensive. You don't just have the cost of the technology of a screen going into a room. You've got the installation of that, and you've also got the, I guess, disruption and closure of that bed space while you do that work. And, noise and dust in a hospital are never good things. So it can be a real headache. So obviously sometimes that just needs done. It's great. We've got an amazing team that can manage it well. But the idea of having a mobile offering where patients can use their own device to get access to some of the information, education, service requests or meal ordering really lowers the total cost of ownership and makes it much more flexible, because you can then start working on the pre and post discharge side of workflow as well. So that's exciting. It's definitely exciting to a lot of the people I've been chatting to recently as well. And back to my experience as a patient, when you're in, I guess, pain and shock, we've thought hard about the situation a patient finds himself in. And so needing to download an app and setting a username and a password and logging in, those are all barriers. So trying to simplify that product has been quite important to our design and product team. And so they've found a way of making it as simple as possible. So it's a web app. You don't need to download an app from the App Store and things like that. So that's what's definitely really exciting for us at the moment.
Amazing. Well, thank you for your time today. We really appreciate it. It's been an insightful chat. And first person I've chatted to that has done some serious market research.
Yes. But maybe for the last time, let's hope.
Yeah.
No, it's definitely recovering well. So I'll have some stories to tell with the wound and the scar. But no, it's recovering well. Thank you.
Amazing. All right. Well, we'll thank you for your time today and look forward to chatting to you again soon.
Great. Thank you very much.
We hope you enjoyed this episode of Talking Health Tech. Make sure you like and subscribe and share this episode with someone who might find it valuable. For more information and resources about healthcare innovation, visit talkinghealthtech.com.